chairpersons of the first session to come on the stage and take over the proceedings for today. Dr. Arvind Kanchi, Dr. Smriti Sinha, Dr. Ashwini Gade, and Sandeep Kumar Panda. We have a mix of the young and the not so young. And we have an eminent panel led by none other than Dr. Vivekanand Jha, who would be in the best possible position to teach us what is the way forward for the new nephrology, early career nephrologist or final year residents. The panelists for Dr. Vivekanand Jha would be Dr. Vijay Kher, Dr. Pallavi Prasad, Dr. Arup Datta, and Dr. Sachin Soni. Over to the chairpersons to start the discussions.
That really makes things go.
This is a session to get lessons from कल के एक भीष्म पितामह थे, एक आज के भी हैं, so.
I was approached and I think there was conversation in between the members of the panel also as to what is this going to be about, right? What are we going to do? And so this is not going to be a real heavy, content-heavy type of presentation where you have PowerPoint slides and so on, but more like a discussion as to what do we think and where we have reached to where, how and why have we reached where we have reached, taking experience from one's own life and basically discussing them out and sharing some of those with the group here. So the title of the session has been, the path less traveled also is the road less traveled is included in the title. So I think let's just focus on that a little bit. And as is very obvious is that this panel represents in both in chronological order but also in order of experience a whole range of I think 40 to 50 years, I guess. I think Dr. Kher, you started your nephrology career I think in the late 70s. And many of you have started your careers in the last 5 to 10 years, right? So there is a big range of 50 years or so. So I think the opportunity in the 1970s, nephrology was a curiosity more than anything else. The Indian Society of Nephrology had just been established in 1970. Dialysis had just started in the late 1960s, etc. Transplantation started in the early 1970s. And so to think of taking up a career in nephrology itself was a leap of faith, right? And that was truly the road less traveled, which included around the time, about 10 to 15 years later, when Dr. Arup Datta and I think we are next in order of, if nothing else chronological, how we entered nephrology, and then perhaps Dr. Arvind, and then Sachin, and all of you here. So, Dr. Kher, maybe I ask, can I ask you and take the, yes. So in the 1970s, you have to keep it pressed. That's the way it works.
Even switching on doesn't work.
It is not switched on.
Yeah, I think what Vivek has said is right, that when I started nephrology and why I chose nephrology at that point of time was basically that both D.S. Rana and we were class fellows in internal medicine, so we did internal medicine in PGI Chandigarh, and those days PGI also used to have these guides. They would put faculty members as guide, and Dr. Chugh happened to be a guide when we entered as undergraduates, as just early postgraduates in PGI. And it is Dr. Rana and myself, both of us decided unit 1 was Dr. Chugh's unit and Dr. Datta's unit. He was a liver unit. And we both decided that we will stay in Dr. Chugh's unit and we would do nephrology. So we had...
But Why did you decide that?
Why was basically mentor. I think Dr. Chugh impressed us tremendously during our early sort of presence in the case presentations. He was very vocal. He was inspiring kind of a personality, and that's
so you bring in the value of mentorship.
Yeah,
When does mentorship stop?
No, when does it stop?
Yes.
No, it never stops.
It never stops.
It never stops. It never stops. And Dr. Chugh continued to inspire till his last breath, and he continued to mentor also and guide all the time.
Would you advise everyone seek out
No,
a
I
mentor?
think if there is an advice that I would want to give to a younger person would be to pick up a mentor, whether you decide to go into a private practice or you want to go into an academic medicine. It's always good to have a mentor. Work for some period of time, maybe 3 to 4 years after your post-graduation, say in nephrology, you've done your DM or DNB or you are preparing in the final exam. I would think that it would be good to pick up a mentor at that point of time. Maybe 1 or 2 also, you can use them and talk about how to develop that career. And mentoring for 3 to 5 years with a mentor probably will make you much better clinician, maybe a better thinker, even a researcher, whatever you want to do in life. So I think it's very important to mentor.
Yeah. And so, Dr. Datta, next, if I can come to you, you also come from the same stable of nephrologists, as do I. And in terms of, Dr. Kher mentioned about private practice, and often people say private practice, government practice. I would like to say that there is only good practice and bad practice. There is nothing like, I think you practice nephrology well or you don't practice it well. Those are the 2 things. So in terms of going into this bucket of private practice, you were senior to Dr. Kher, I think. So you also came out of PGI, which was an intensely academic environment, and you decided straight to go into a non-academic at that time, which were very few at that time in the late 1980s, early 1990s. There were very few opportunities available. So how did you navigate yourself? And you would have had to set your own rules of navigation. So how did you do that, and what are the lessons out of those?
So, when you finish your training and you begin your career, there are 3 ways you can do it. One is academic, and academic can be teaching as well as research, and the other is obviously practice. Now, academic and research, you have to be in a government institution. In my case, the situation was that there was no vacancy even in West Bengal, where I wanted to settle back because I'm from the city. And also in Chandigarh was obviously kind of locked at that time. And in fact, when I passed, the next PSC intake was 2 years after that by an exam, and you would have been posted in a primary health center as a medical officer. So that was the scenario in West Bengal. So you kind of by default, you have to join private hospitals. So the situation was very peculiar at that time, in the sense that there was a huge dearth area, very few hospitals doing nephrology and dialysis centers, but you have to be attached to one of them in order to practice the specialty. Otherwise, you will forget the specialty. So, and you will have to take whatever is offered, and which was not very good, I must say. After so many years, it doesn't matter, but it was really not so nice at that time. You could practice elsewhere, but you're not in a hospital. But if you're not in a hospital, you don't practice nephrology, because it's a very high-end subject at that point of time. And mind you, I was very young, and with this kind of a scenario like dialysis, transplants just was taking place, who would trust a 30-year-old person at that time? So you have to be in a hospital, and the hospital will give whatever it wants to sort of give you. But it is a dearth sector, and there are enough people, but there are few hospitals with dialysis. It's kind of a locked situation. But you do that in order to remain in this specialty, which I did, and then things fall in place gradually. In 2-3 years' time, things start taking place. I was lucky in the sense that there was a few new things were coming at that time. So my real, I would say, the purpose of doing nephrology was kind of being an early adopter to whatever was coming and becoming, state of the art elsewhere. So I am wistful that I have not been part of the science, which I would have very much liked to, part of the science which kind of developed those treatments, but I'm kind of satisfied because I was an early adopter of that, and I brought that into my place.
Yeah, thanks. So again, a number of lessons there. One is obviously the role of opportunity. You know, what is the opportunity that you get? You said that those doors are not open when you were starting out, and so you regret having missed that opportunity. Maybe regret is not the right word, but you would have taken that opportunity had it come along. So please do be on the lookout for opportunities. And those opportunity windows sometimes may open for a very short period of time, and you need to really make sure that you make the best use of those windows. The second, Dr. Datta, as you said, that I think being on the lookout for what is going on around you in your own field and trying to be an early adopter is something that you described. Is that we often like to operate in safe environments, is we want to continue to do what we have been doing for some years, and if something new comes, then we are somewhat diffident in seeing what might it hold for us. But I think using it, perhaps what you would also like to add, I think, is that using it judiciously. Anything that you adopt and look at it from all sides and then adopt it judiciously. And while you are using it, also continue to evaluate how it is doing and make your own experiences.
Vivek, can I?
Yes, you are the boss.
Sometimes, no, not the boss. Sometimes I just wanted to make a point that it becomes so difficult in life that you don't get a teaching hospital attachment, you don't get a corporate hospital attachment like me. I had nothing in hand, and you may have to take the road less traveled or sometimes make your own road to reach there, in which case I had no dialysis attachment, no hospital attachment, and yet when you start your practice, maybe I initiated this aspect of setting up in a very small unit or a satellite unit, a dialysis setup, and yet you could probably build on it. And as you said, no teaching hospital, but yet you can teach maybe MD physicians or MBBS people and things like that, or the paramedicals, and yet move on further. So there would be opportunities.
Right, absolutely, Umesh. And as you said, you have been a pioneer in the kind of model of practice that you set up. You know, multiple units and using those units to create a network and using then that network to become a force multiplier at multiple levels, at the level of primary care physicians, etc. Now, coming to you, Dr. Arvind, you trained here and then you went overseas, right? And you spent how many years overseas?
I was there for 3 years in the UK and 5 years in Singapore.
So, good 8 years, and then you decided to come back. That's also something that Dr. K did, and I also did at one point. So, what made you decide to come back at that time? It would have been relatively easy for you to find a career in those days in one of those Western countries, high-income countries, etc. And when you came back, what challenges did you face in terms of having a cultural, technological adaptation to the Indian healthcare system? You came to Bangalore, and at that time, if I might be so bold to say, Bangalore was relatively backward in terms of nephrology setup compared to some of the other cities, even in southern India specifically. So what was your experience and the lessons that you drew?
So as far as education in the West goes, be it in the UK or otherwise, I would say it is good to have a different perspective. Going abroad gives you a different perspective of looking at the patient. They have a different way of dealing with the patient. We have a sort of, possibly, at least in India, a way of looking clinically at the patient. They have a different way of analyzing the patient, and that's something that, you know, is good in the sense that we tend to imbibe new things when we go abroad and get a bit of experience there. Coming back to India was a decision I made because in every, perhaps not for many of you, but in every sort of society that you live in, there is a hierarchy. And there are advancements that are possible only to a certain extent. And when you realize that the advancements are not occurring according to your plan, you realize that perhaps, you know, it is better for you to be in your country. The other thing was my children, education of my children. I was definite that I wanted that to happen in India. And those were the factors that led me back to Bangalore. And as I said, when I came back to Bangalore, the scene was such that if you wanted to practice nephrology, something akin to what Dr. Khanna said, you needed to go to hospitals, break open doors to set up dialysis units, and actually physically get a dialysis unit installed and start dialysis. That's just what I did, because you had to go to smaller hospitals. There were only a few institutions practicing nephrology and dialysis when I went back. The others were smaller hospitals. Corporates were yet to come in. And that was the situation where I had to actually physically speak to people and say, look, we'll start dialysis. We started transplant units also in these hospitals. So it is a road less traveled, there's no doubt about it.
Yeah, so that would be something which perhaps the nephrologists of today, fortunately or unfortunately, won't have to go through that kind of experience, right?
Sure.
There were those days, some of you described, and Dr. Khanna, and also Arup and Professor Kher, is that in our days, we knew everything about a dialysis machine, right? What are the innards of the dialysis machine, how to fix it if it breaks down. And now, if I might again say this, if you make a trainee stand in front of a dialysis machine and ask them to start the machine and operate it, they will perhaps get paralysis of some sort. I think it's really important. I don't know how many trainees are here, but I think it's really important to know the technology that you use, because you can get the technology to do what you want to do only if you know it. Otherwise, technology can become your master, which is not the goal. And that goes also to the point that Dr. Datta was making, is if you are an adopter, you have to know that technology, or whatever you are adopting, you have to know it well. Now, if I can come to you, Sachin, you also, after your training, you did a fellowship, and then you came back to, and that's the other thing, you came back to Aurangabad, right? Not really a top-tier city at that time, I would say. And that's something, if people have to set up something, they have to go to lower tier cities. But there is no shame in going there. I think the infrastructure has improved quite tremendously. And you started a number of new things in Aurangabad. So what experiences did you have, and what lessons did you draw from there?
Yeah. So Aurangabad was one of my choices even when I was doing my nephrology. I got into nephrology because during my MD, I did from GMC Nagpur, and we had a kidney unit there which used to perform only stick PD. There was no hemodialysis in Medical College Nagpur, but that kidney unit, there was one resident posted, and he always used to be in demand. So kidney unit resident was always known, and I got fascinated with that, and that time itself I chose to get into nephrology. I did nephrology from Hyderabad, and then, as you said, I got a fellowship. And when I came back, I had two options, because I wanted to remain near to my parents. Of course, I am from a taluka place originally. My parents were there, but I couldn't go to a taluka place. So Aurangabad was a social decision or a family-oriented decision to remain in Aurangabad.
But
and
you
when
did set up the unit, and what was your experience?
I wouldn't say exactly I set up the unit because I think I represent a generation maybe 20 years later to all Kher sir, Datta sir, and I came to Aurangabad in 2009 after all my training. Units were there, but there were very few, and there were limited choices to join the hospitals. So of course I was offered kind of inferior job, or not to my expectation, but still one has to start work. So I joined a place where already there was a transplant program and there was a dialysis unit, but subsequently we could kind of take it to next levels, introduce many things in Aurangabad. Aurangabad, I just want to let you all know that for reasons of my seniors like Dr. Bhavikar, is known for kidney transplants. If I would say in Maharashtra, if you look at the density of population and number of transplants, Aurangabad may be leading. And I got opportunity to work in that kind of atmosphere. Another thing peculiar about Aurangabad is, like some nephrologists were already doing vascular access surgeries, Dr. Bhavikar included. So that also made me get into vascular access. So these 2 points I picked up, transplantation and vascular access surgeries.
What is the value of a nephrologist? What is the importance of a nephrologist now being proficient with these access procedures and some bits of intervention, what is the importance of a nephrologist knowing all of this, especially if they're practicing in tier 2, tier 3 cities where an extensive support network is not available?
To answer this, I may take little more time because
we don't
many
have a
times
lot of time. You have to be very concise.
So many times it is necessity is kind of drives you to do all these things, and probably that was the reason our seniors started, and I took it forward. And you said why it is important, because now, like, if even in Aurangabad a new nephrologist doesn't have attachment, as Dr. Khanna said, like there is no place, no vacancy. So now every new individual has to identify himself or project himself with something, and I kind of been successful in projecting myself with transplant and interventional nephrology, and interventional nephrology is important for all incoming doctors.
So you established a niche for yourself using, so I think that's the other thing, you try and find a niche for yourself. The opportunity for that goes, becomes smaller and smaller as more and more people emerge. Now, if I can pass on to the three of you, the millennials, if I might say, Ashwini and Pallavi and Smriti. So you've trained in the 21st century, right? Late in the, by the standard of 2025, relatively late in the 21st century. And you've started your careers where at a base which had been set up by a number of people. So what are the challenges that you are, I wouldn't say challenges, but what are the life lessons that you have learned? Starting from training, I would say, because training is an important one. And please consider this a safe space, so please say whatever you think is right. Is what gaps did you experience in your training which you had to later on compensate by other methods, etc. And what is the support that you have got, and what advice would you have for people who want to start nephrology at this time? So maybe starting with you, Smriti.
Thank you so much. I trained at Medanta with Dr. Kher, and it's been only 4 years since I've passed out. And when we came into nephrology, when we were passing out, we had a lot of questions looking at our seniors' career. Should we go abroad for training? Should we go for fellowships outside? And I remember talking to Sir once, and he said that currently the scenario of nephrology, thankfully in India, is such that most of the, at least the good training institutes, offer you an exposure to almost all the setups and the latest technology in transplant, in intervention to some extent in some centers, and general nephrology, of course. Yes, we do lack in the dialysis aspect, I'm sure, because for us, when we trained, there were other things.
So identify 2 gaps in training that you see all around you in the Indian nephrology training centers.
So I think currently the main identification for all of us is which area we want to actually work in, because like Dr. Sachin said...
But when you train as a nephrologist,
yes,
right? So what are the 2 gaps that you identified during your training, which you would have liked to have experience to know more about?
So in corporate setups, peritoneal dialysis is something that is severely lacking. And in some setups, interventional nephrology is also, like for us, we were exposed to one aspect of it, but other things I had to pick up when I went out and trained with other people.
So as a result, do you think now in your practice, are you confident in managing patients on peritoneal dialysis?
No, sir. To be very honest,
so that is a gap that,
yes,
that you hope. So how will that kind of gap be covered, if I can come to you, Ashwini? What is the advice you have now for program directors, right, people who have those programs?
So our teachers in that era most likely are in comparatively a steady state career. They joined the setup and continued as all the aspects of nephrology. And in current era, people to have the work-life balance, try and choose the profession, a transplant nephrologist or an interventional nephrologist.
Is that a bad thing?
No, that's a good thing. That's a good thing to have a good balance, as in to achieve the good balance. But for that, I think henceforth, we only have to choose our area of interest and build upon that. See, we have already received all the basic knowledge. Obviously, after that, it's our job to build upon whatever our interests are. Your interest may be now, my interest, because of the case I developed in transplantation, and in Medanta, I had lots of exposure to it. Now that I have changed my working area, I'm finding new opportunities. Like there are lots of onco patients, and I'm getting interested in it. So according to whatever is available, you can build upon that, I guess. And you have already achieved a basic knowledge in terms of training. But henceforth, job is ours only. Try and find out where you can get, and there are lots of like these platforms. There are many platforms where you can gain access to. There are many nephrologists who are doing similar work which you are interested in, and you can easily get
All
in
right,
touch
thanks.
with them.
So then coming lastly to you, Pallavi, again, if you can expand on some of those points, and the last question I would ask you specifically to address is the three of you who are relatively young, right, are, as it turns out, Dr. Umesh Khanna selected you are females. So females have a particular, especially of the age that you are in, they have a particularly challenging job in any profession of medicine, of making sure that you balance your family lives with your professional lives, still try to advance in your careers as much as you can. So what advice do you have for other colleagues? So if you can add that also into your response.
Thank you, sir. So, first of all, addressing your last point first, as we haven't discussed that earlier. So, all three of us are women nephrologists, and I think at least in this era, I do not think we have as many barriers to development of female nephrologists as we might have had in the earlier years. There's of course women in nephrology, but even without it, at least in my experience, I did not feel as if I was differentiated from my male colleagues. But yes, there is a work-life balance which all of us are expected to manage. So I think what is most important is for all female nephrologists that they have to, again, identify what is their priority and choose their niche area. Choose their niche area according to their work-life balance. So if they are interested in one particular topic or field and they choose a mentor accordingly, I think it's easy for them to navigate the time right now. And apart from that, like, so you were talking about the gaps. So I did feel some of the gaps during my training, but what I would like to say is that once your training is finished does not mean you stop learning. So you have to accept you don't know certain things and learn from others. They might be your juniors, they might be your colleagues, or they might be your seniors, but you have to be ready to learn them.
Yeah. Great, thank you. I think we have covered a range of issues, and the last point is extremely important, that learning is lifelong. It doesn't stop just because you finish a particular training program, etc. And I think these kind of sessions are really very, very important for it. So I know we are close to over time, but I've taken permission to go a few minutes over, and I'll return back to Dr. Arup Datta and Dr. Vijay Kher in kind of summing up what we have all heard. And ask again a couple of other specific questions, Dr. Kher. You have the unique distinction, if I might say, of having traversed the entire circle of professional careers, right? Having trained overseas, then having worked in an academic institution, setting up an academic institution, working in India, and then coming into the private sector. What is the lesson that you would like to, again, in the next 2 minutes or so, would you like to? And one more question, if I might say. Also address how can some of these gaps, because you will be in these national board curriculum development committees, etc., these gaps that young colleagues are identifying, how should we address that as a community?
Yeah, I think what you said is important. For a young person, I think looking up at an opportunity and a niche area is something that they must identify during their training itself. They must get exposure to every aspect of training, and I feel that if there isn't a specialty which is existing, say peritoneal dialysis, I think we should rotate these students into hospitals or departments where these facilities are being done. And I think as a core curriculum for national committees and all those organizations and examination boards and all, I would feel that probably in sort of auditing as to whether these things have been provided to the student as a wholesome kind of a training, we should be sort of looked at by these boards. I guess that would be my recommendation probably. I think
what is the value of going overseas, these kind of rotations, etc.?
Overseas is exceptionally good, and I think Arvind talked about it. I think exposure and even thinking in a different plane, different aspects, learning to see same thing in a different fashion. And I think that increases the horizon of your thought process tremendously. I got exposed very early to basic sciences when I worked in the lab itself, and that increased my overall understanding of nephrology, the clinical fundamentals of how clinical medicine would get improved on totally. So I think exposure to some of these areas is extremely important for your development as a whole. And I think that's very, very important. So exposure outside, I would think, has a positive impact.
And anything that you would like to reflect on through your career trajectory from academic center to private sector?
I would think that some period in academics, if one can get an opportunity, everybody will not get an opportunity. But if there is an opportunity for some period of time, I think one should spend 3 to 5 or maybe some more years into academic medicine and then get into a private practice will become something very, very ideal. So I must consider myself very, very fortunate to have many of these opportunities and therefore probably that has helped me to be a better nephrologist as well as be a better person.
Can I ask Vijay one question?
Yeah.
So you have just passed from, say, a government teaching hospital, done your DM, and you have an opportunity to continue there, and there is a corporate job waiting outside, and that's a kind of dilemma with many of the early career nephrologists will face. Is there something which could come from you to help them in making this choice?
Yes, I would think that if, especially, even if he wants, ultimately the person wants to get into practice at some point of time, I would still feel that experience of 3 to 5 years, probably, maybe 5 years would be an optimal kind of an experience for him or her to gain that kind of experience of research methodology. Even looking at, in a government setup you will have, or in academic institutions, the number of patients are fairly large. So for you to get exposed to a variety of nephrology problems, which as a trainee you may not conceive or may not understand that well. After your training you will be able to understand that much better.
We'll come to you. Dr. Datta, your reflections.
So I also agree that an exposure outside is important. And as I think Dr. Kher has been extremely fortunate to have done those sequentially outside and then in a government sector. So probably this is kind of a model career, if I may say. Very few people will have that actually. So, and I think an outside exposure, whatever be the time, the third opportunity, the third possibility would be at that point to go out for an exposure. That can also be considered. Few years. It opens up completely. And that kind of a global view is important nowadays. You can't be restricted to our own kind of place.
Just, you said early adoption. For early adoption, you have to be on the lookout for something new coming up. How do you do that? How do you really see that you are at the forefront of new knowledge, being in a private sector?
Firstly, you have to be up to date. That's number one. It's easy now. It was not easy in our times. When we were out of PGI, there was no journals. The journals stopped. I mean, we could not afford them. We used to go to conferences in trains, stay in 100 rupiah day rooms and attend the conferences, and we could kind of devour everything that's been spoken there. And if somebody gave a journal, it was good. But you are always on the lookout and things what is happening, and then as soon as you get an opportunity, you just start using it in the private sector, and then build from there, basically.
Good. Thanks. We are over time, but I'll go just once more round the panel and ask you to summarize in 30 seconds your final reflection, starting from you, Smriti.
So I'm just going to take on what Dr. Umesh Khanna said. Since most of the trainees passing out nowadays are DNBs as compared to DMs, I went back to Nair and did a 2-year course in government hospitals, and I think that was the most holistic kind of training that currently India can offer. You can pick up on whatever you want because the patients are so much.
Great. Thank you, Arvind.
Apart from, being a nephrologist, you can, during your nephrology career, look at other options to try to improve yourself, look at medical writing, look at research, look at social media, look at IT in medicine. There are so many other things that you can branch out while being a nephrologist, and that's something that you may want to think about.
Ashwini?
Just prioritize yourself, specialize in some specific way, and also be in touch with academic, be it you are in private or public, doesn't matter. The academics will keep you inspired because that's how you grow in your field also.
Pallavi?
Sir, I think just to sum it up what everybody else has said, that you should know your priorities. And secondly, I think you should not be hesitant to reach out to others and to collaborate, because I think it's a specialty where working as a team is going to really help. You cannot work as a standalone, although a lot of people are doing that. But I think that really helps you a lot.
Sachin?
Identify your strength, project your strength, practice ethically. There is no need to practice unethically. And remain dedicated to your patient. Your patient is your property, and that identifies you. If you have a patient, your existing hospital wants you, another hospital demands you, pharma is behind you, you will get research, you will get everything. So be patient-centric, remain dedicated to your patient.
Great, thanks.
Vivek, can I take the opportunity of being the organizer, one question to him?
Yeah, you always have.
Sachin, if you were given a second chance and there was an opening in Mumbai, would you have taken Mumbai or continued in Aurangabad?
No, he came to Aurangabad for personal reasons, he said.
Oh, okay.
So that's the end of story.
I would still go to Aurangabad because I get to experiment in Aurangabad, which I wouldn't do.
Now he has found gold in Aurangabad. Yeah, so obviously it's a retrospectoscope that he has put on. So look, let me take the privilege of moderating to summarize a few things and also to add a few, really. I think I am very glad that Sachin brought in the word ethics towards the end. It's really important that I said there is good practice, there is bad practice, and good practice has to be ethical. So don't forget ethics. Unfortunately, there are a number of colleagues who are being identified in some way or the other associated with some unethical practices. I think it is our responsibility as a community also to discourage that wherever we find that it is happening. That's number one. Number two, I think the one point I would like to plug to all of you, because all of you here, are most of you at least, are very senior people, and you run training programs, etc. And the point that was made by Smriti and Dr. Kher before that is the value of not just plunging into practice right after you finish your training. So spend a couple of years, because there is still a lot to be learned, especially for those who train in DNB programs in a private hospital. In the West, there is this concept of doing PhDs. So a lot of students, after they finish their clinical training, they go to PhD programs. And those PhD programs are an opportunity really for you to, one, discover some bit of research. You may decide whether to or not to pursue that later on. But secondly, also to work in academic settings. And doing PhD doesn't mean that you don't do clinical work. You will do clinical work, but at the same time, you are also identifying a question, clinical question, and going in depth on those issues. I think we must promote that. And if you talk to your DNB students and are able to sort of interest even a small proportion of them to do this, I think that would be a success of our training, and there will be more holistic nephrologists coming out in the future. And as the only person making a strong plug for research, I have to say that research should be an integral part, no matter where you are. And don't think that research requires some special knowledge, special skill, etc. Even counting your patients is research. You know, counting your patients, describing the variations that you see, writing case reports also, but write case reports which are truly educational, not just a routine case report that this is the first case report from Nagpur or this is the first case report from Chhattisgarh, etc. Those sorts of things, because writing helps you think more than anything else. Writing is not writing. Writing is to stimulate your brain. It helps you think as to your thoughts get clarified while you write. And when you write, you are also forced to look into new developments that are taking place. And let's not kid ourselves. Many of us who are in private practice, when you get into the jet stream of private practice, I think the time to update yourself, as Dr. Arup Datta was saying, it becomes deprioritized. The updating yourself becomes deprioritized. The last thing I would say is, and if that happens, then the only opportunity you have is to come to meetings like this. So when you are here, please don't go on the beach. It's good that the time was given in the morning to go to the beach, but when you have the sessions running, please come to the sessions. I have noticed, at least in some cities in India, and one big city, it is not Mumbai, it is not Kolkata, it is not Chennai, but it's a metropolitan city which will remain unnamed. You go there, you will see no nephrologists coming for sessions. They will come only to sessions that they have to speak in or chair in, right? And so that's really bad, that's sad. And that indicates a degradation of the culture of knowledge, education, and research in those places. Whereas where that doesn't happen, there is always success. So I would just conclude with those remarks, and I would request all of you to give a big round of applause to our panelists.
And thank you, Vivek, and I think he deserves a big round of applause for bringing into focus something which is not discussed in meetings and conferences, and I thought it would be a good idea.
The one more plug I would make is, please read the editorial coming out in the next issue of the Indian Journal of Nephrology.
Right, we will. And I must announce that at the Mumbai Kidney Foundation, we wish to set up a mentorship program for which I will need the help of all these people and all of you all. And let's see how it shapes. But this is my dream, and I would want to try and set it up in whichever way possible.
Thank you very much, sir.